Hey guys, happy Wednesday, good afternoon, thank you for joining us. I'm Janelle. We wanted to give you guys kind of a chance to ask your questions about coronavirus to the experts themselves. This is Dr. Catherine Troisi. She is with UT Health. She's an infectious disease epidemiologist. Her title extends way beyond that. So much so that do you want to tell us?
It doesn't matter. The important part is I study infectious diseases.
So she's here to answer all of your questions. You guys can leave them right there. I'm following them along on Facebook so I can try to ask whichever ones we can get to. You can ask her directly, whatever questions you have about coronavirus, because we at KHU are trying to, our theme is to spread facts, not fear. And I know obviously there's lots of concern going on with coronavirus right now. So here we are, we've got her live right here on Facebook. Whatever questions you have, leave them right there in the comment section. I'm gonna try to follow them along as best as I can and get you guys the answers that you need to maybe just feel a little more comfortable with your day-to-day. Okay, Dr. Kathy, first, I guess let's just talk a little bit about, there's new developments on this every day.
Yes.
Today, we had our first death outside of Washington State, so we're up to 11. Just talk a little bit about how this is evolving every day.
Yeah, because you can only find cases if you test for them, and unfortunately there have been some issues in the United States with availability of testing kits. But as new kits are being rolled out, which is happening this week, we are going to see more cases. It's also the situation that it was only a week ago, not even a week ago, I think that we had our first indication of community spread. That is someone who had not been to China or in contact with someone who had been in China. And if we measure how infectious a virus is by how many people on average someone with that virus infects. So it looks like with this virus that about each person who's infected infects about 2 to 3 people.
Really?
So you start with one person, then you get 2, and each of those infects 2. So now you've got 4, and you can see why we're seeing more spread and more cases throughout the community.
This was predicted, right?
Oh yeah.
Yeah.
We knew it was going to happen. And
it's kind of inevitable. I know that it's going to keep spreading, obviously. When does it slow down?
Well, a good question. We don't know. There is hope that in the summer it may slow down, but this is a new virus we haven't seen before, so we don't know that for sure. The other factor is what we as a society do. They're called non-pharmaceutical interventions because we don't have a vaccine, we don't have antivirals. We can do quarantines, as has been done, and if we start seeing a lot of community spread and a lot of illness and or deaths, we will probably start practicing social distancing, which means that schools may close, movie theaters, sporting events may shut down. And we know from the 1918 flu pandemic, which was a long time ago, but we know that that works. There's a famous study of 2 cities, Philadelphia and St. Louis. And Philadelphia did not shut down public events early on, and St. Louis did. And Philadelphia had a whole lot of deaths from the flu, and St. Louis had some, but not as many. So we know social distancing works.
Okay, so at what point do you enact that?
Well, luckily that's above my pay grade.
Okay, well, it's above all.
No, yeah, but I mean, the person who will be making that decision for the city of Houston is Dr. David Pearce, who is our public health authority. And there are many things he has to take into account, how serious the disease is, how widespread it is, but there are also business concerns, obviously. So it's a very, very tough decision. And
then you don't want to incite extra fear if it's not there, and
you don't,
but you also want to be cautious. So
yeah.
I can see.
And if the schools close, that means parents have to find child care, and so they are not doing what jobs they have. So there's a lot of ramifications.
It's really tricky. Okay, let's see if we can start looking at some of you guys' questions. Sorry, give me just a second. Have you been busy lately talking about this a lot?
Yes.
I bet you have. Well, thank you for making time for us today. Okay. Oh, we've got quite a few comments already. Sorry, guys. I've just been chatting away. Okay, let's start with... So Robin says, she says, I'm immune suppressed. Is it wise to have my back surgery in the next couple of weeks?
You know, that's obviously something to discuss with your surgeon, who will take into account the risks versus the benefits. And things are changing so fast, it's just hard to say what will be happening. Think a week ago, how things have changed.
I know, and it just seems to be constantly, but that's obviously something that she should have a conversation with her doctor.
Right.
Let's see. Does COVID-19 contain HIV-like mutations on 4 of its receptors, which would give direct access to our cell?
So, HIV and coronaviruses are both RNA viruses. They're genetic material. That means they can mutate, they can change easily. And I don't know that we have seen any mutations on the receptors. The virus mutated to be able to infect humans in the first place. It came from bats through the pangolin. And so there were some changes.
So it's possible.
It's
a little too early.
But I think the question is asking, so viruses enter your cell through receptors, but it already is doing that. So
I see. It's already mutated.
It's already.
I see.
Yeah,
So they have confirmed that it came from the pangolin?
We know it came from bats. I don't know that it's been 100% proven it came from the pangolin, but we're pretty sure that's where it came from.
And so that meat market, though, that's still...
Yeah, it looks like there was one event. One person initially got infected.
Okay. Let me see. What happens... Lori wants to know what happens to the body when infected.
The symptom, well, first of all, as I said, it looks like about 16%, so 16 out of 100 infected people have more serious symptoms. It looks like between 2 and 3% die. That number may go down. Most people will have either mild symptoms or maybe more like the flu, but not so severe you need to be hospitalized. And the symptoms are basically the same as the flu. Fever, muscle aches, cough, sometimes diarrhea and nausea.
And so when you say the 16%, those are more severe. Which are those the ones that you're talking about? The fever, nausea, cough?
No, those are the ones that...
Those are the mild symptoms.
Those are the ones... No, I mean, you
sorry.
can have a fever that's 100 or 104. It makes a difference, right? The 16% are the people who probably are hospitalized.
Okay.
Have difficulty breathing.
I see.
But you can have the flu and it be so bad that you have to be hospitalized, or you just take care, you stay home and rest, and that's the difference. And then there's an unknown percent who may have no symptoms. We just don't know because we're not testing for them.
Interesting. And so when you talk about the people who are hospitalized, are these more people who have the underlying conditions?
Yes, and that includes an older age, over 65, and particularly over 70 or 80. If you have diabetes, heart disease, chronic lung problems, those are the people who are more likely to have to be hospitalized and to die.
And what would you say to that population right now at this time?
Wash your hands a lot, stay away from sick people. And you might want to stay away from crowds. We have not had any confirmed cases in Houston, but we will. I mean, it's inevitable. It's inevitable.
Pamela wants to know, what about money being handled, even doctor's visits?
Yeah, again, just wash your hands a lot and try not to touch your face, which is very hard to do. There are studies showing that most of us touch our face about 25 times per hour. I think I'm like double that.
Me too, for sure. No, you absolutely think about it more.
It's a hard habit to break, but to really think about touching your face. And the reason is that you can inoculate yourself through your mouth or nose or eyes.
Interesting.
So, yeah.
And
so
it's,
just, wash your hands a lot. Use hand sanitizer.
because no matter
soap
what
and
you
water.
touch, whether it's money,
Right,
door
doorknobs,
handles, your phone even. I mean, we don't even.
And we don't know how long the virus can last in the environment. Those studies just haven't been done.
Yeah. Okay. So, Deborah's asking, should eating out be not so good of an idea right now? What are the food establishments doing to ensure employees are not infected with virus and they're using good healthcare protocols?
So this raises an interesting dilemma that only about 3/4 of workers in the United States have paid sick leave. And the lower paid jobs, like food handlers, are less likely to have paid sick leave. Therefore, if you are sick, you're deciding between staying home, which would be the right thing to do, and a paycheck, and that may be food on your table or rent. Food establishments need to be sure that employees are not sick when they come to work. The virus is not spread in the way like hepatitis A or things like foodborne illnesses. So you don't have to worry about your food, but if there's an infected person in a restaurant, they may be coughing or sneezing, and you may get infected.
So it's just kind of another one of those things where maybe avoiding, I don't know.
Well,
because you don't want to tell people not to do that.
It is a tough decision, and I can tell you, I personally, although I am over 65, I don't have any underlying conditions. I have not changed my daily routine. I am planning on flying to St. Louis in 2 weeks to see my grandbabies. But if I had heart disease or something, I might be
a little more cautious.
Yeah.
And what are you going to do when you go? You're just going to wash your hands.
I'm going to wash my hands. I am not going to mask. It is not recommended, and it's taking masks from people who need them, healthcare workers. Wash my hands and try not to touch my face.
And just try to be a little more, I guess, aware of your surroundings. Right. And let's see. Christopher asks, is this a blood-borne or airborne pathogen? And what is the mortality rate here as relates to infection? In short, do we know how to get it and what common sense you can do to avoid it?
Okay, so this is a respiratory virus. It's spread through the air, not through the blood, not like HIV or hepatitis, which is spread through blood. We know that it is spread through droplets. So even as I'm speaking, there are little droplets coming out. If you sing, if you cough, there are droplets. Those droplets have the virus in them, but they're pretty heavy, so they fall to the ground. Gravity catches them, and they don't usually go past 3 to 6 feet. So if you're 6 feet away from somebody, even if they're coughing, you're pretty good. There's another way that respiratory viruses can be spread, and that's through aerosol, and those are smaller particles. We don't know yet whether the virus can be spread through aerosol.
Is that how the flu is spread? Okay, so we don't know yet if it's being spread exactly like the flu?
Yeah, I mean, we talk about the respiratory route, and they're both the respiratory route. It's really that distinction between droplets and aerosol, which is,
interesting.
Sort of arcane.
Okay, so is that an extra precaution that you would, just because that's another unknown that we don't have yet?
No, it's the same thing. Stay away from sick people. Wash your hands. Don't touch your face.
All the same things.
We know that with viruses in general, stress makes your immune system not work as well. So try to get enough sleep. Don't panic, because there's no reason to panic, and because it's not doing your immune system any good.
That is true. Okay, so Gina wants to know, is it remotely unsafe for us to eat something from China or the origin of the coronavirus?
No. It is not spread through food. So there is no concern about food from China, or indeed items that may have been shipped from China.
And Doris wants to know, does hand sanitizer really work?
Yes, hand sanitizer is very effective. Soap and water is better only because if you have some dirt or something like that on your hands, soap and water will get rid of it, and hand sanitizer doesn't really get rid of junk on your hands. But if soap and water isn't available, hand sanitizer will kill viruses, yes.
And there's never a reason to use both, right?
No, you do not need to use
You don't need to overdo it a little bit. Okay. Let me see. Frankie wants to know, what about daycares?
We're still learning a lot about this virus, but unlike flu, where the people who are most likely to die from flu are the very old and the very young, under 5 years of age, we are not seeing a lot of infection, and I don't know that there have been any deaths in children.
Really?
We don't know why. Now, again, the situation is changing, but if it were a big problem, we would be seeing those deaths. That's a wonderful thing. So daycare, they're not at higher risk.
It's interesting that there is that one distinguishing factor that we have seen so far between the two viruses.
It is.
So it makes you wonder what exactly it's doing to our bodies once it's in it. That's and obviously something we'll learn.
Yeah.
Eventually. Let's see. How long does it live on things?
We don't know for sure. Those studies will be coming, but there was one initial study that said 9 hours. One study you can take it with a grain of salt.
Sure.
But it does last in the environment. On the other hand, this type of virus, they're called enveloped viruses. They have a envelope around it, and they last less time in the environment than non-enveloped viruses. So that's a good thing.
So say someone who was infected coughed on that table over there. The study says that it could last up to 9 hours on that table. Okay, so that's the max, probably. We don't know.
Maybe.
We have no idea.
It also depends on the humidity and the temperature and some other things as well.
And then if I came along and I put my hand on that table, that's the whole washing your
then
hands,
touching your
washing
eyes
your
and-
hands, for sure. Okay. Let me see. Stephanie wants to know, can you talk about transmission? How is it transmitted exactly? Droplet, contact, airborne? That's droplet.
Right.
That we know
and
of.
through fomites, the contact. Fomites are environmental surfaces that, just like you said, you cough on that table, I come along later, touch it, I don't wash my hands, I touch my eyes, and I can get it that way.
And then airborne, that's the one that we're still...
Airborne are the droplets.
Oh, that's still the droplets.
Yeah.
Okay. How long do the symptoms last?
They appear to be, well, again, it looks like not everyone even has symptoms, but we're not testing everybody. So, and it looks like for the people who are sicker, it can be 2 or 3 weeks.
2 or 3 weeks. So that's a while.
Yeah.
How do they treat, this is actually my question, when you go, once you are diagnosed that you have it, what is the treatment plan?
So there's no specific treatment. As I said, we don't have antivirals. It's called supportive care. It's basically, if you're seriously, seriously ill, it's keeping you alive until your body can get rid of the virus by itself.
And that would be the hospitalization?
That would be the and the ventilator, yeah, to help you breathe.
So outside of the 16%, the people who are showing those symptoms, it's common flu care, go home, rest,
chicken soup,
fluids, all those kinds of things. And that's until your body can get rid of it itself. Interesting. I didn't know if there was something more going to a doctor would do, but it doesn't seem like.
Yeah.
Unless if you're in that 16%.
People are so worried about being tested, and from a public health standpoint, we want to know who's infected because that tells us something about the spread. But from an individual person's perspective, unless you're seriously ill, and even then, it doesn't really matter whether you have coronavirus or not. You need the ventilator, you need, serious medical care. And if you just have milder symptoms, you're fine staying home. Again, except for studying how the virus spreads, it doesn't really matter because there's nothing specific we can do. Interesting.
Yeah, that's true though, because you're not going to go get a shot and get a cure.
No, and there's no drugs you can take.
Exactly. Okay. Sarah says if you get swabbed for flu and come up negative but still have 103 and headaches. What is that? I mean, that sounds like...
there are a lot of viruses that cause, we call it influenza-like illnesses, ILI. So it could be another virus.
So,
it's hard to tell.
Yeah, and so, but when it comes to
Also, those tests that swab you are not that
really
specific. Yeah.
Really, and so when it comes to someone showing the signs of symptoms of coronavirus, what are the actual things that the CDC would be looking for to approve them for a test? Because they have to get.
Well, yeah, and that's changing. It used to be you had to be severely ill and be either have traveled in China or be in contact. That is being relaxed as we realize that community spread is happening.
So, but they decide on the CDC level who gets tested, right?
Well, once those tests are rolled out to state labs and big city labs like Houston, then CDC won't be making that decision. They'll be making the decision. And it'll be based on availability of tests. And again, from a public health standpoint, once we find out that coronavirus, the SARS-CoV-2, is in the Houston area, the health department doesn't care so much about. That is the wrong
No,
word.
I know what
Sorry,
you're saying. No, but I know what you're saying.
Yeah,
they want to know who has it.
Right. It doesn't matter
it.
whether I have it or not. They know it's in the community. They know that precautions need to be taken. Right. So public health labs aren't clinical labs like that. And if I were showing those symptoms and I went to my physician, and if I did, I would not be in the, I would not go to the waiting room to potentially infect other people. I would call and say, I'm showing these symptoms. What do you want me to do? Sorry, I lost my train of thought.
It's okay.
So even to be tested then, my doctor might be interested, is this coronavirus? But once we know it's spreading around, it doesn't really matter because there's no specific treatment.
Exactly. I think it's more to track it, right?
It's from a public health standpoint to track who's getting infected. And for research studies, because we want to know who's infected so that we know what the fatality rate is, the case fatality rate, and we know, how transmission may be spreading. But with flu, we don't, we track it to see how bad it is in the community, but we don't monitor each and every person that has symptoms.
I'm sorry, guys. I'm getting to your questions, I promise. Okay. How do you test for coronavirus? We kind of just talked about that.
Right. There is a lab test that will test whether you have the virus, not whether you had the virus and are now over the infection, but scientists are working on that.
And this person's asking, should we eat at a buffet at this time? But that kind of goes along the same lines of...
Right. I mean, you're not at higher risk from food. It's really, if you're worried about crowds. Again, we have not seen any cases here in Houston, and not to say that it hasn't, that it's not occurring,
here,
but it's certainly not widespread, or we'd be seeing cases.
Sure. Stephanie asked, how long can the virus live on the surface? There's one study that says 9 hours.
Said 9 hours.
So that's a possibility.
Yeah.
We're not sure. Cassie's asking, can I touch my face after I wash my hands?
Sure.
Maybe immediately after, but not much long after that.
As soon as you touch the bathroom door handle, you may have recontaminated your hands.
Yeah. So Danielle's saying, is it mandatory that people that go to the doctor with symptoms, you now have to test for the coronavirus as a precaution?
No.
No.
It is not. We don't have enough testing yet.
Yes. And speaking to that, that's something that is changing soon.
Right. CDC is sending out those test kits this week. Hopefully by next week, we'll see more widespread testing. And when we see more widespread testing, we will see more cases. It's not that the actual number of cases went up. We just have detected them.
We just know they're there. And so what about COPD and heart patients?
They are at higher risk. If you've got chronic obstructive pulmonary disease, your lungs are already compromised, and now you add a pneumonia or something to it. And the same thing with heart disease. Your heart is already compromised. Now you're putting a bigger strain on it. So the case fatality rate is the number of people who have the infection who die is higher in those patients.
And so those are the people who you may suggest avoiding large crowds.
Yes. But flu also is another issue. Now, the difference is we can vaccinate you against flu. And even though the flu vaccine is not perfect, it does prevent hospitalizations and deaths, and that's what we want to do. So
Exactly. And I think when it comes to people who have the underlying conditions, maybe it's just not worth it to even take that risk.
Right,
If there is,
maybe.
even if there is
Yeah.
a concern too,
Right.
to have that in
Right.
the back
You
of your
have to make
head.
that decision
Exactly.
yourself.
Okay. David's asking, how long can the virus live outside the body? I'm concerned about all the products we buy from overseas. How are we making sure we're not importing more of the virus?
So as I said, this envelope viruses, which this is, do not last they don't last weeks and weeks in the environment. That one study said 9 hours. So it's not really an issue about things that are imported from China. The other thing is that once we get more, so the odds are we are going to have widespread community widespread. And so worrying about something coming from China, it's going to be here. The virus is going to be here. Mm-hmm. So, yeah.
Okay, so let's see. Danielle wants to know, should people with asthma take precautions and how?
Yeah, asthma is another comorbid condition, just like COPD and heart disease, immunosuppression. And again, you may want to be more careful about washing your hands, about staying away from sick people, not touching your face, and, avoiding crowds. Might be a wise thing to do.
What about traveling? Gina says we're traveling to San Francisco in 2 weeks. Should we postpone?
That's a hard decision. And but I will say that the situation here is changing rapidly. It depends on how late you can wait to cancel your trip. I personally, if I were going to San Francisco, would not cancel the trip now. But in 2 weeks, if I'm seeing a lot of coronavirus there and not here, that's the other thing. We may have coronavirus here. We will have coronavirus here, and so you may not be at any higher risk in San Francisco than you are here in Houston. But we don't know that right now. So,
what about when it comes to people who are hoping to book trips in a month or two?
Have some good travel insurance is what I would say.
Really? Okay.
Yeah.
Because what happens if this becomes spread or comes into the Houston community? What would prevent someone from traveling? Would there be restrictions? There would be restrictions.
There aren't going to be restrictions, although we do see that there aren't flights to China.
Yes.
And Italy and Iran are also, I believe you can't. Maybe they're just quarantining people coming in from there. I don't know. But we can. The airline companies are going to stop flights if nobody's booking them anyways.
Sure.
Yeah.
So just travel insurance, okay.
Yeah.
I mean, we're all kind of in the same boat where
we're all planning for the summer, right? What
sure.
we're going to do.
Sure.
So,
Yeah. Okay. Let's see. We talked about the virus living out. Okay, we already talked about that one. Okay, Miriam's asking, would the coronavirus affect the food supply coming from China? We already said no, it's not foodborne.
Well, I think she's asking a different question. It's not, well, maybe I'm wrong. It's not whether the food is contaminated, but will the supply chain be affected? I'm not sure.
Food supply, yeah, you might be right.
Yeah.
Sorry,
Yeah.
Miriam.
We certainly are concerned about, about supply chain. So much of what we import comes from China. Now they have been seeing fewer cases, so maybe we'll
start ramp back up.
Yeah. But I know the business community is very concerned about that.
Have we seen any impact so far?
CDC has.
Sorry, we've got our station running behind us, so it's definitely got some noise back there.
CDC has said that there is one of our concerns are prescription drugs, because a high percentage of our prescription drugs come from China. CDC has said that there is a shortage of one drug, but they are not saying what that drug is. So yeah, we have seen some. And I think Apple phones are affected.
Sure.
And yeah, we have seen some.
But
some
that's the extent of what we've seen so far.
Yeah, I mean, we're not seeing shortages of.
We have a question about pregnant women.
Yeah, so again, we're early in the epidemic. When during pregnancy, high fever can be bad. So it's not specifically this virus, it's if you have a high fever with it. We just don't have the data to know whether there is an increase in spontaneous abortions and miscarriages if you're infected. There has been a study of 19 women, so very small, who were infected during pregnancy and gave birth, and their babies were fine. So that's good.
All 19 have already given birth?
Yeah. Where they were at the end of their pregnancy.
Really?
Yeah. It's been 2 months.
That's impressive that we are that far, that we know
in
that.
China.
Sure,
Yeah,
no, I
not
understand,
here. Yeah.
but even that study's been done.
Yeah, exactly. Now, and again, it's early and things may change, but.
Okay, interesting. But if you are pregnant, what would you recommend?
Well, again, I would recommend taking extra precautions. Just like I said, wash your hands, don't touch your face, stay away from sick people.
Mm-hmm. All the same stuff. Let me see. If I develop a fever, this is Etney asking, if I develop a fever or any other symptom, how do I go about getting diagnosed in Houston? What if my doctor's office refuses to see me?
Right now, I doubt that someone who's not severely ill is going to be tested because we don't have those kits yet, or they're just arriving. I don't know what to say. I would think your doctor wouldn't refuse to see you. They may not want you to come into the office to potentially infect other people.
Yeah, but that's when we've talked about, calling ahead and letting them know your concerns.
And maybe they'll come out to the car, your car, to see you.
Dora wants to know, is being anemic considered a weak immune system, and would the virus be more aggressive?
I do not know of any studies that have looked at people who are anemic. I don't think that affects your immune system.
Okay, and Pamela says, can the virus reoccur once you've been cleared of it?
That is an interesting question, and because with most viruses, you get measles once,
sure.
right? You get mumps once.
Sure, you get immune.
With influenza, you can get it every year because the virus changes. There are some preliminary studies from China showing that people have been reinfected.
Oh my gosh.
Again, this is early.
Yeah, okay.
Not a lot of information, and definitely something we'll be looking at. What I would assume, and the study I read did not have this information. What I would see, I'm touching my face. What I would assume is that if you get it again, it's a weaker. Because now your immune system is primed, you have antibodies, so maybe you get it, but you're not as sick.
And Danielle wants to know, how does your body get rid of it? How can your lungs get rid of it once it reaches your lungs?
So our bodies are quite used to fighting infections, and we have an immune system that it may, for something new like this that nobody's seen before, we won't have, our immune system isn't primed for it. And that can take a while. It can take 2 weeks.
Is that one of the reasons why we're seeing a longer recovery?
Probably.
Okay, interesting.
Yeah, and so, but eventually, if your immune system is working fine, and the problem is, as you age, it doesn't work so well.
That's life's nice little secret for us.
Right. But eventually, you get antibodies and T cells, and it fights the virus and makes it go away.
But but because it could mutate means that it's a possibility that
you could see it
that's
again.
The early results. That's a very small study in China that we still, okay.
Right. But, it's important when we talk about a 2% case fatality rate,
sure.
2 out of 100, it's terrible for those people, but 98 people have survived.
Yes.
So most people's body bodies do get rid of the virus.
And I know we were talking before about that death rate, and with the number of people who haven't been tested, who may have just fought this off on their own, that death rate, that's probably the highest it could be.
Yeah, probably.
Because
we're only testing those hospitalized severe patients and who are more likely to die. The person who has a milder infection, we don't test, and they're not going to die.
Which could be so many more people.
Which could be so many more people.
Which would drop that death rate. And I think that's a good thing for people to realize.
Right.
Just because the more calmness you can have, I think the better. Okay. What's the incubation period?
It looks to be between 2 and 14 days, although there have been a few studies that show it might be longer than 14 days. But the generally accepted number is 5 days on average.
Oh, really? 5 days. Okay. Glinda says, we have trips on cruises in May and October to Italy. Do you think it's safe to go? Oh.
Yeah, well, you know, cruises are
rough
a lot
anyways.
Of people together. And it's just hard to say because the virus may disappear by May. It is just hard to say.
Really?
Yeah.
That's so interesting. Okay.
And you know, October, if the virus comes back, which even if it goes away this summer, it will probably come back in the fall. And October is the start of flu season. So if this virus acts like flu, you might be.
So I did read that somewhere that it may now be. Will it be a seasonal thing?
Yeah, it's called endemic. It's just around all the time. Yeah, it's like seasonal flu.
So it might be something that we'll see.
Right. But, you know, this time that we're seeing it, everybody's seeing it. Everybody's body is seeing it for the first time. Nobody has immunity. Next, you know, if it comes back in October, some percent of us will have fought off the infection. And even if we're not totally immune, like with flu, we'll have a milder infection.
And so why would it go away in the summer?
Good question. We don't really know about why flu goes away. Some of the theories are that the virus is less likely to survive in the environment when there's higher humidity, which means we should never see it in Houston.
Ever?
Right?
What?
Yeah.
I mean, my hair today is like there's no virus around.
Yeah. The other thing the other reason, speculation, is how people interact. That in the winter, kids are in school. And kids are a really good way to spread any infectious disease.
Interesting.
Yeah, and so in the summer you just don't have that as much opportunity for spread.
So could it be a combination of that?
Oh, absolutely, and probably other things we're not thinking about. Now, when it's summer here in the northern hemisphere, it's winter in the southern hemisphere, and they are seeing flu every year.
So it's opposite.
Yeah.
Interesting. Yeah. Okay. Can I catch the virus by eating food cooked by other people?
Not unless they cough or sneeze on you. The food is going to be fine.
Food itself is. Let me see. Clorox, Lysol, alcohol, all which are preferred disinfectants.
Yeah, a 10% alcohol solution. 10% Clorox solution will kill viruses. Lysol kills viruses. Alcohol, you have to have it 70, 80, 90% higher. So not, you know, I've seen a hand sanitizer, do-it-yourself recipes that instead of using rubbing alcohol, which is 90+% alcohol, instead they recommend vodka, and the highest percent of vodka is only around 40. So, you know, vodka would not, although why would you want to waste your vodka disinfecting your table, right? Yeah.
It's a great question. Yeah. Let me see. Could it mutate? We've kind of talked about this a little bit.
It is an RNA virus, and RNA mutates pretty easily. There is a report out of China yesterday, I believe, it could have been today, saying that it has already mutated, that there are 2 strains. Now that was, again, a very small study. We'll see. But the virus mutated originally to infect humans. So some change in those cell receptors
And this is what you were talking about, why maybe someone could be infected twice. Interesting. Okay, so do you know these numbers? Tim's asking how many people have died due to coronavirus in the U.S. compared to the flu this year.
I do know those numbers. The let's see, the death rate is 11 for coronavirus. Since October 1st, which is when we start counting for flu season, estimates are that 16,000 people have died from influenza, and this isn't a particularly bad season.
It is or it is
Is
not?
not.
Is not. Okay.
Yeah.
Oh,
We've actually seen this year more pediatric deaths because of the type of flu that's circulating. So I don't know. Last week it was 109 pediatric deaths. I didn't look it up this week, but it's the second highest number ever recorded.
Wow.
Yeah.
So someone, Jesse asked us, do current pneumonia shots offer any help?
No.
Okay. Where some people are talking about the death rate, which we've also discussed. Why haven't all medical facilities begun testing all patients suffering from pneumonia as a first place to find where the virus and who has it?
That would be a good thing to do if we had the testing kits. And the original testing kits that CDC sent out had some problems. They had to recall them. They're now, they revamped the testing and those kits are being sent out, but we just haven't had the capability to do it.
And this is a good conversation some people are having. Can you boost your immune system to help you fight the virus a little better? Are there any vitamins you can be taking?
Not really, but just, getting enough sleep, trying to reduce stress, eating well, exercise, those things all make you healthier and help your immune system.
Are there any vitamins you'd recommend people just to be taking on an everyday basis? No? Okay.
There are a lot of studies showing
Get some sleep. That's your vitamin.
Right.
Okay.
Vitamin S.
Is it safe to give babies pacifiers?
Well, if it dropped on the
clean,
floor, I might not
yeah.
want to, but yeah.
Make sure it's
Just
disinfected
make
before
sure
you do
it's
that.
clean.
Any known cases of children having it?
I do not know of any cases of children having it. I think once we start testing more, particularly for asymptomatic infections, those infections that don't have any symptoms, we will find it. But I don't know of any cases.
Tiffany says, I work for a doctor's office. How do we protect ourselves?
So you want to make sure when your patients come in, as I said, that they are not infecting other people. Healthcare workers are at higher risk, and in a hospital setting, if you are a healthcare provider, you would be masked if you're around people who have the virus. We don't recommend that for other people, but you are at higher risk if you're a healthcare provider. Again, it's just common sense hygiene messages or practices. But you are at higher risk. That's just the bottom line. Same with flu, although again, the difference is you can be vaccinated.
So when it comes to the masks, why do they not work?
The surgical masks, those green or white ones that you see, are to prevent, if I were masked, it's to prevent me from infecting somebody else. They don't fit very well here, and so air and particles can get in and you can still be exposed. There are other types of masks called N95 masks. The 95 mean that they clear about 95% of particles. Those are what you would use in a hospital setting, but they have to be fitted to you. There are different types, and it depends on how big your face is, and you have to, there are tests you can do to make sure that it's actually preventing particles from getting in. The other problem is, we've seen a shortage of masks because people are hoarding them, and healthcare providers need them. And when other people that don't need them are using up the supply, that can be a problem. The other reason they don't work is, besides the fact that there's not a tight seal, particularly right here, is people need to cover their nose, which they may not do, and they may still go under the mask to touch their face. They may wear it too long, and it may give them a false sense of security, so that they don't wash their hands as often as they should.
Yeah, that's what I would think would be the main problem, is that you think that you're okay, you don't take those other precautions that the CDC and everyone is telling us that these are the things that you need to do. Right. Okay. Chloe's with us here. Chloe, how are we doing? We got any more questions? What about animals? Have we seen any evidence of this hurting animals?
I almost hate to say this, but there was a report again yesterday or the day before out of China that a dog was infected. We do know that animals can have their own coronaviruses. This is one dog, one test, and so I certainly am not saying that is what's happening. But of course people are going to be following up on it. The other thing is that we don't know, even if this dog truly was infected with SARS-CoV-2, that whether it can infect humans.
And so how many studies do you think are being done right now on this virus?
I think a lot of studies are being done, but until we can test more people, a lot of that information is going to be lacking.
Interesting. And do you think the virus we're seeing here is different than the virus they saw in Wuhan?
I don't know. I don't know, and as I said, there was one paper published showing that the virus has mutated. So I don't know. People will be looking at that.
When we say mutated, would we see any difference in symptoms? Would we see any difference in the virus? What does mutated actually mean?
Well, mutated just means changed. So sometimes viruses mutate and then they can't infect humans. So that would be good.
That'd be great.
Yeah, go ahead. It could mutate that it's so. Okay, I'm going to get technical here.
That's fine. We'll try to follow. Okay.
The reason people die from this infection is because the virus gets in their lungs and they can't breathe. Okay, so that's your lower respiratory tract, and that your body temperature there is higher than it is in your nose. Upper respiratory viruses, like the common cold, you don't die from the common cold. You might feel like you're going to, but you don't, because it's infecting here, not your lungs. So the virus, this virus right now appears to be infecting both the upper respiratory tract, so your nose, your sinuses there, and that may be people who have milder symptoms. In some people, it appears to go down to their lower respiratory tract, and that's when they're more seriously ill.
Does it start here?
Yeah, because that's where it's coming in.
Okay.
You know, you're breathing it. We don't know why that happens to some people. But back to your original question.
I'm sorry, I'm all over the place here.
No, it's me. The virus, if the virus changed, mutated, so that it was more likely to infect your lower respiratory tract, or less likely, then we might see differences. Probably not in symptoms. It's still going to be fever, cough, that kind of thing. But less, if it were less likely to infect than less pneumonia. So yeah, we could see some differences. Probably less likely in symptoms, but in how the virulence, how bad the infection is. And also it can mutate and become more or less transmissible between humans. So.
Chloe, I could talk to her all day, so you cut me off.
No, I mean,
you cut me off.
Your world.
You cut me off. I was going to ask, when it gets into the lower tract, have we seen people come back from that?
Oh yeah,
Absolutely.
Definitely. So 16% of people, it looks like right now, have the more serious infection, and those are probably people where it's in their lower respiratory tract. Of that 16%, not everybody's dying. Only 2% out of everybody's dying. So yeah.
So that's the difference.
But you need supportive care in the hospital. You may need a ventilator. You may,
sure,
to help
to
your
help
body
you
get
breathe,
over
to
it.
help you.
Right.
And so that's what we're talking about. The difference in the 16% is that. I don't know the math. What is that? 88? No, 8. Oh gosh, don't make me do this. 84. 84% of people, it would stay upper. 16% it would go lower. 2%, it actually can be fatal.
Yeah, I mean,
Roughly,
that may
kind
not
of
be,
roughly
yeah,
that.
and it may be that in the 84%, maybe they do have some lower respiratory infection, but their body is taking care of it.
Sure.
So they don't get pneumonia.
Interesting.
And they don't need to be hospitalized.
Okay. All right. Do we have any more questions? We have more questions. Okay. My husband's in EMS. What do you recommend?
You know, EMS, I'm not sure.
Kind of the
because,
same thing?
Yeah, I mean, but I don't know how often EMS would be, personnel would be exposed. You know, would you call an ambulance to pick you up? I don't know.
Oh, true.
You know,
That's true.
I'm not sure that the exposure would be that much. Certainly not right now because we're not seeing it.
So once the first tests are confirmed here in Houston, because we know it's inevitable,
It will happen. Yeah.
will they be quarantined?
Probably. So the Public Health Authority in a jurisdiction, which, as I said, for Houston is Dr. David Pearce, has the legal authority to quarantine someone. He and every other public health authority is very reluctant to use that.
Sure.
Sometimes it's necessary with TB patients. He would instead hope that he could convince the person, the infected person, to self-quarantine
At their home.
at their home, right?
I think if you give them the two options, they'll probably be like, I'll stay home. I'll stay
Yeah.
home. Let me see. Someone asked if a CAT scan can detect the virus.
No.
No, okay. If you're over 75 and have COPD, should you wear a mask in public places?
Again, the mask doesn't really protect you, although there have been some studies that show with flu, people who wear those masks, even though they're not perfect, are less likely to get the virus. That's a personal decision. It would probably be better just to stay away from crowds.
Public places.
Yeah.
Just because it's not
if you,
worth
if
it.
you can.
Okay. Should we pull our kids out of school?
Not at this time.
I think that they'll stay on top of that.
Oh, absolutely,
Yeah.
absolutely. Meetings during disasters or outbreaks, the city health department, the county health department, the state health department, CDC, they all have what's called incident command structure, and there's daily or more than daily briefings, telephone calls with the state and CDC. I mean, yeah, your public health people are on top of it. Now, I have to say that funding for public health has been cut. There are programs that have been cut, so I would say that public health is on the ballot in the fall, and you know,
Keep that in mind.
Public health is out there protecting you, and if they're doing their job, you don't know about it because there isn't an outbreak. You don't get sick eating at a restaurant. Your air quality is good, so yeah, it's important.
What's your overall view of coronavirus right now? Could it have been worse? Is it as bad as it could be? What do you think?
I think we just won't know. I think that we are going to see widespread coronavirus. What we don't know is if it will be mild, moderate, or severe. It could be very bad. It could be very mild. And people get sick, but they're not dying. It doesn't disrupt life. I think what's maybe more disconcerting right now is the false information that's out there that's panicking people. It's important to get your information from credible sources like CDC, WHO, your local health department, and stay, be prepared, but don't panic.
Be prepared, but don't panic. Those are good words. What do you think, Chloe?
I think we're good.
Thank you
All
guys
right.
for your questions. Thank you so much.
You're welcome.
For answering my million questions today. All of mine too, as well as you guys. But thank you guys for tuning in. We hope that we answered a few of your questions, calmed some of your fears. But we'll be covering coronavirus for a while. So.
Yeah.
For a while. So just stay with us. I know coming up later today we have more stories going on, so stay tuned. And we will see you guys next time. Thank you so much.
You're welcome.
Thank you. Bye, guys.